most important symptoms in women is breast lump. Okay, whether it's painful or it's not painful. If you have any lump that you just recently discovered, this is, I would say, urgently go and see the doctor. Now, the breast lump in the breast usually are painless, be it cancer or non-cancerous. So don't wait until you feel, oh, this is painful, now I go and see the doctor. Because that is usually not the case. Okay? The lump, breast cancer lump, usually hardly painful. There are other symptoms as well, like bloody nipple discharge. Nipple discharge is very common, but bloody nipple discharge is something I would say red flag already. Alright, and of course, in advanced cases, you have changes in the skin. The usual one is thickening of the skin, and the pores become very obvious. So it become like the skin of an orange. Alright, of course, later on you can have ulceration, and that is a late stage. So we don't want to catch them during this stage. We want patient or female to come much earlier, so the treatment is better, the outcome will be better as well.
So for women above the age from 40 and above, they should go for regular screening, which includes mammogram and ultrasound scan of the breast. Combining both these investigations will give the best chance of detecting any abnormalities within the breast.
In general, or in the guidelines, mammogram start at the age of 40. Alright, but ultrasound you can start earlier on. If the woman have family history of breast cancer, usually we will take 10 years younger from any of the family members who has breast cancer. Say the mother had breast cancer at the age of 40, so the daughter will start screening at 30. But then we will ask to do ultrasound rather than mammogram. Okay, and if you do mammogram and your baseline mammogram is normal, so usually we will say about 2 to 3 years once you need to repeat the mammogram. But ultrasound you can do every year because ultrasound is safe. No no radiation. So it can be done every year during your medical checkup and all that.
So once a breast cancer is detected, first they have to do imaging to confirm what stage of cancer the patient is at. So if it is an early stage breast cancer, they would start with surgery first. So surgery could involve a lumpectomy or wide local excision. And now if the nodes are not enlarged, the surgeons would do something called a sentinel lymph node biopsy, whereby only selected lymph nodes are taken for examination. However, if patients present with larger tumors and with enlarged lymph nodes, then they would need to start with chemotherapy first to shrink the tumor. So chemotherapy, it could be a combination of chemotherapy with targeted therapy or immunotherapy depending on the factors of the tumor. Following chemotherapy or targeted therapy or immunotherapy, the patient will go on to have surgery. The surgery could be a breast conserving surgery or a mastectomy depending on the size of the tumor and the response following the treatment. After surgery, the patient would then have radiotherapy to reduce the risk of recurrence in the breast or the chest wall. Following that, they might need further adjuvant therapy in the form of chemotherapy, targeted therapy, or immunotherapy.
Right now, we are planning to get intraoperative radiotherapy. What is intraoperative radiotherapy? Intraoperative radiotherapy, like I said just now, when you have breast cancer and in the cases where we don't do mastectomy, we will radiate the radiotherapy. But this is done after the patient recover from the surgery. Now, the new advancement is whereby during the operation, when we take out part of the breast tissue, we radiate, meaning we put a radiation in the cavity where we took out the tumor and radiate the breast tissue, so that after the operation, patient doesn't need to go for radiotherapy in early breast cancer or in a very low risk patient. patient who is more high risk, we still need to do radiotherapy, but then we are reducing the time, the numbers of radiotherapy that they need to go for. So it shorten the treatment of the breast cancer for the patient.
So for breast cancer or for any other cancer as well, we now do it's personalized treatment, cancer treatment. It's not one size fits all. So we would send the tumor for specific testing. We call this next generation sequencing to see what mutations are present within the tumor, so that the treatment, whether it is with chemotherapy, targeted therapy, immunotherapy, or a combination of this, would be best suited for the patient. So this is available at KPJ Damansara. Also for radiotherapy, for breast cancer specifically, our linear accelerators that deliver the radiotherapy treatment. So we use a specific technique for radiotherapy planning called VMAT, which would minimize the dose of radiation to organs at risk like the lungs, heart, and will maximize the dose to the breast tissue so that the patient has less side effects. Also, we use something called a specific way of monitoring the patient's respiration, so that the tumor gets a set dose of radiation and the underlying lung dose is significantly reduced when we are able to deliver radiotherapy only during a specific phase of the patient's breathing cycle.
Prevention is always better than cure, all right? So how you want to prevent breast cancer? If you are at higher risk, meaning you have family members with breast cancer, or you have certain other things like you're married late, children, first child is over 35 years old, do screening. Okay, do screening, mammogram, ultrasound, because that would help. If you have very early breast cancer, what we call DCIS, ductal carcinoma in situ, this is curative. So if you can catch at that time, that is the best prognosis. So and if you do breast self-examination, breast self-examination can save many women as well. The moment you feel your breast is not right, doesn't matter whether there is really a lump or not, go and get an ultrasound and see doctor and do mammogram if you're more than 40 years old. So I feel the more you are aware of this condition, the outcome is better.
Cancer is not a death sentence, so women must come forward and screen, because we can also detect changes in the breast before they become cancer. That's why screening is important. So what we call stage 0, we pick up cancers or changes in the breast tissue before they become cancer. This means the patient's chance of cure is 100%. The second is if they detect a lump, to come early to so that they are when they present at an earlier stage, the chances of cure is also much higher. Also in patients with metastatic disease, now with latest advances in treatment, there are newer technologies and treatment options available which can give the patient a good quality of life and a long quantity of life as well.